Good morning.
Good afternoon, good evening to everyone joining us today. I hope you can hear me. Can you hear me well? Okay. So it is a privilege to welcome you all to this critical discussion on climate change, health, and well-being in urbanizing Southeast Asia at the 12th Asia-Pacific Forum on Sustainable Development. First and foremost, I would like to extend my heartfelt gratitude to our esteemed co-organizers and also speakers, Dr. Pechpilai Latanan from Chulalongkorn University, Thailand, Zia Raman from the Asia Development Alliance. I'm sorry if I pronounce the names wrong. And Professor Jonathan Rick from the University of Bristol, Dr. Nguyễn Đức Lộc from SocialLife Research Institute in Vietnam, and Professor Nguyễn Văn Kính from Vietnam Medical Association, Dr. Trương Hồng Sơn from Vietnam Medical Association, and Dr. Nguyễn Thu Giang from the Institute for Development and Community Health, LIGHT, in Hanoi. And so invaluable collaboration and dedication have made this event possible. So seeing the number of participants here today is not only heartwarming, but also deeply motivating. It reaffirms that we are not alone in recognizing the urgent need to address the growing intersection of climate change, health, and social vulnerability in Southeast Asia. So you know that Southeast Asia is urbanizing at an unprecedented pace, bringing rapid economic growth and opportunities. However, this transformation is also exposing deep structural vulnerabilities, particularly in the face of climate change. So extreme heat, air pollution, water insecurity, and the increased frequency of climate-related disasters are not just environmental concerns, but they are existential threats to human health, well-being, and livelihoods. And these challenges are not experienced equally across society. The most vulnerable, precarious elder workers, low-income urban communities, and rural populations are on the front lines of climate change impacts. Street vendors, construction workers, porters, and motorbike taxi riders who sustain urban economies, but they are disproportionately exposed to extreme heat, storms, and air pollution, and rural farmers whose livelihoods depend on increasingly unpredictable weather patterns are struggling with crop failures, water scarcity, and land degradation. Despite these immense struggles, their realities remain largely invisible in public discourse, policy discussions, and even academic research. So climate change does not exist in isolation, as you know, and it intersects with poverty, gender inequality, lack of access to healthcare, and social exclusion. It creates a multidimensional crisis that requires urgent, science-based, and equity-driven solutions. And today, this event brings together cutting-edge research, real-world case studies, and diverse country perspectives to explore these urgent questions. And our distinguished speakers will examine first. We will present the existing knowledge gaps on the impacts of climate change on the health of outdoor workers in urban Vietnam. And second, we examine the effects of climate finance utilization on health and well-being in South and Southeast Asia, the climate change perceptions and realities in Eastern Thailand, learning from community responses to flooding and land conversion. And we will share the qualitative insights into the health and life experiences of precarious elder workers facing extreme climate conditions. So our goal is to move beyond theoretical discussions and towards actionable, evidence-based solutions that can inform inclusive climate adaptation policies. And this discussion is particularly timely as it directly contributes to the Asia-Pacific Forum on Sustainable Development. And what we will discuss today will directly address a number of sustainable development goals. For example, SDG 3 on good health and well-being, SDG 5 on gender equality, SDG 8 on decent work and economic growth, and SDG 17 partnerships for the goals. And furthermore, the insights from our discussions today will contribute to the 2025 High-Level Political Forum in New York, ensuring that the voices, experiences, and needs of Southeast Asia's most vulnerable population are heard on the global stage. So as we engage in today's discussion, we might all want to think critically, collaborate openly, and push for bold transformative action. That is not just an academic or policy exercise. It is about reshaping the way we approach climate resilience, public health, and social equity in Southeast Asia. So before we begin, a few housekeeping notes. This event is being recorded and will be made available on the NatCen YouTube channel for those who wish to revisit the discussions. And you will not be able to use cameras and microphones, but you can submit questions via the Q&A box, and we will try our best to address them during the discussion session at the end. And once again, thank you all for being here today, and we look forward to a stimulating and meaningful discussion. With no further ado, let's start our event. So first in our agenda is a joint presentation between Professor Jonathan Brick and myself. And Jonathan is a professor of human geography in the School of Geographical Sciences at the University of Bristol. He was formerly director of the National University of Singapore, Asia Research Institute. Over to you, Jonathan. Let me share the screen.
That was excellent. It's a real pleasure to be with you all. I'll just share my slides. Okay, how is that? Does that look okay?
Yeah.
Yeah.
Can we put on the present mode?
Right, hang on. I thought I was on the present mode.
I can share my slide, our slide from my side, if you are encountering some technical issue.
Yeah, that maybe we should. Okay, that might be better.
It's not on the presentation mode.
I know. Is that working through the slides there, Anne?
Would you like me to share? But you need to stop sharing so that I can share my screen.
Okay, there we go. Can you share them then, Anne?
Yeah, I'm trying. Request. Could you see the screen?
Yep. Excellent.
Yeah.
Okay, sorry about that.
It's okay.
So this this presentation comes out of a Wellcome Trust funded project that Anne and myself are working on, and we're looking at climate change, extreme weather, outdoor work, and the health of outdoor workers in urban Vietnam. And like many studies, we started by thinking that we should do a systematic literature review. And as we were doing it, we thought that it would be interesting to examine whether literature in Vietnamese language and literature in the English language were telling the same story. And this presentation is about the differences between the two literature reviews in those two languages. Next slide, please, Anne. So this comes out of a debate that's ongoing about the tendency for literature reviews to focus almost exclusively on English language sources. And there was a paper a few years ago that examined 250 systematic reviews in PubMed, and it showed that 1/3 explicitly excluded non-English articles, 1/3 didn't mention the question of language, and 1/3 claimed no language restriction, but actually, in fact, 4 out of 5 papers excluded non-English sources. So our guiding question was this one on the slide. Does the Vietnamese language literature and Vietnamese-based studies of climate change, outdoor work, and health mirror studies in English? Next slide. And it speaks, as Anne just mentioned, to a set of the SDG goals on good health and well-being, gender equality, decent work, and partnerships. So very quickly, we took the usual systematic review approach. We developed search strings, developed inclusion and exclusion criteria, piloted those search strings, and then we examined the literature in a set of well-known databases, Scopus, Web of Science, and PubMed, and we then screened for duplicates. And we had a set of search strings that you can see here to try and narrow down the literature in English and in Vietnamese to those papers that spoke directly to the interests of our project. And I suppose the first challenge that we had that's worth talking about is that we obviously had challenges in finding synonyms for the words in English and the words in Vietnamese. And we have to be careful to be clear that sometimes words that may appear the same actually mean subtly different things. So that was one of the first challenges that we had to address. And it's a challenge that persists, that sometimes the actual words themselves may not quite capture the same set of issues. So we identified, as you can see, we began to narrow down the literature on those three databases, Scopus, Web of Science, and PubMed, and we ended up with 734 papers in the databases. And we then narrowed them down further. We screened them at the title and abstract level. We then looked at the papers in full text, and we ended up with 18 extracted papers. Something to bear in mind was that the actual databases operate in different ways, so we couldn't do exactly the same level of analysis of each. And you can see here the Vietnamese language, we ended up with 8 papers that we thought spoke directly to our issues, and in English, 18 papers. Next slide. Yes, now the review. Very quickly to run through the differences, which we've summarized here in this table. So you can see the second column, the English language literature and what it emphasized, the third column, the Vietnamese language, and some notes in the final column. And I'll just work through each in turn. Well, the first thing to say is that the Vietnamese language literature was entirely quantitative in approach. So there were no qualitative studies at all. And that says something, I think, about the evidence, or what counts as evidence in Vietnam and what counts as evidence in English. The English language literature did entertain the possibility that maybe qualitative or mixed methods approach would have something to contribute to the questions that we were asking. There was also something interesting about the way that weather and health were considered across these two sets of literature. There was a tendency to overly medicalize health in the English language literature, and maybe when it comes to weather, taking an overly meteorological approach to weather. The Vietnamese literature, slightly different views of what actually health encompasses and what weather encompasses. And that's something which has been termed methodological planetarism in Barak's recent book published last year, which reduces some of the weather questions to questions that sort of fit a particular scientific approach to what weather means, whereas the Vietnamese literature was sort of broader in approach. And that made us sort of reflect on what is included in weather, and perhaps the Vietnamese literature sort of picking up a sort of broader, rather more nuanced view of what is in and what is out when it comes to thinking about climate change. Then the causes of vulnerability. The English language literature, there's a lot of talk about intersectionality and the way in which vulnerable people are exposed, whereas the Vietnamese language literature, it was more focused on the formal sector. So informal sectors workers were largely excluded from the analysis. And that made us sort of reflect on how national norms in Vietnam render some groups and individuals more visible than others. Then the question of responsibility. In the English language literature, the sort of sense that society at large and the government have a role to play, whereas in the Vietnamese language literature, very much a focus on individuals who have to adapt to climate change rather than society supporting people in that effort. And that sort of speaks to the methodological individualism which you sometimes see as a sort of critique in the English language literature of that sort of neoliberal approach to development and development challenges. And finally, sort of policies. The English language literature always sort of felt the need to say something wider and bigger about what was required, whereas the Vietnamese language literature, perhaps understandably, focusing on the sort of here and now of Vietnam. So what does this mean for Vietnam? And that perhaps speaks to international publishing norms and the way that if you publish in an international journal, there's always, or there tends to be a requirement to take your context-specific case studies and use them to say something bigger and wider. So 4 integrative points, that there is a difference between the literatures. We shouldn't assume that the English language literature, if you like, can speak for the world. It can't. The focus on practical context-specific adaptations, very much in evidence in the Vietnamese literature, less so in the English language scholarship. The Vietnamese language literature, tendency to overlook the structural causes of vulnerability, whereas that was very much a feature of the English language literature. And international publishing conventions, we think, force people or force scholars to always kind of take a step back from the minutiae, the detail of their cases, to try and embed it in wider debates. So I think now it's over to you, Anne, to finish off in the summary.
Thank you, Jonathan. It is fantastic. So our review highlights several key gaps in climate health research. The non-English studies are often excluded, which limit regional insights and reinforcing a Western-centric perspective. And there's also a lack of demographic analysis, with elder workers treated as a broad category rather than recognizing how gender, age, ethnicity shape climate risk. And similarly, informal urban workers, such as street vendors and motorbike taxi riders, are understudied despite being highly exposed to extreme heat and pollution. And heat stress really dominates the discussion, dominates the literature. And while there is very little attention to non-heat climate hazards, and most research focuses on individual coping strategies rather than systemic and structural factors that shape vulnerabilities in the first place. So due to these knowledge gaps, there will be some policy implications as well. Health systems are not adequately prepared to respond to climate-related health issues, and many adaptation policies fail to target high-risk groups such as elder workers, low-income farmers. And there's a lack of integrated frameworks linking climate, labor, and health policies, which lead to fragmented and ineffective interventions. And also many climate-related health risks remained underreported, particularly those affecting informal workers who lack access to healthcare. And when we conduct these two systematic reviews, we also identify some future research directions. So to fill these gaps, future research must be interdisciplinary, inclusive, and locally grounded. And we need more longitudinal studies to track climate-related impact over time and spatial analyses to understand how climate risks vary across different regions. And more research is needed to explore the effectiveness and existing heat stress interventions, ensuring they are both scientifically sound and socially equitable. And beyond climate science, more research is needed on socioeconomic and structural drivers of vulnerability. For example, housing conditions, power dynamics, labor policies, and healthcare access. And additionally, cultural and behavioral factors, such as how different communities perceive and respond to climate risk, must be better understood to design effective community-driven adaptation approaches to protect the health. I think that is the end of our presentation, and thank you very much for the listening. And next, we will have questions at the end. So anyone in the room has any question, please post in the Q&A chat, Q&A box, and we will address at the end. And next, we will have a chance to listen to Zia Redmond from Asia Developments. And I'm very pleased to, and I'm honored to introduce Zia. He is a mathematician turning into human rights actor and defender. Zia founded Awas CDS Pakistan in 1995, and as development advocate and lobbyist, he led the Pakistan Development Alliance and promoted better governance and accountability towards the achievement of Sustainable Development Goals in Pakistan. And currently, he is the first director and Secretary General of Asia Development Alliance. Over to you, Zia.
Thank you very much indeed, Anne, for this generous introduction and a wonderful presentation ahead of my presentation. My presentation is extracted from a study that Asia Development Alliance has very recently conducted on the role of IFIs and multilateral development banks in advancing the climate financing in Asia. A couple of the slides that I will be sharing with you is from that study concerning South and Southeast Asian countries. As we all know that the South Asia and Southeast Asia is one of the most vulnerable regions to climate change and face, as you have mentioned, heat waves and rising sea levels, flood droughts, and increasingly intense and unpredictable weather events most of the time. If we look at South Asia in the previous 20 years, we have seen that 750 million people, which is almost half of the South Asia population, has been affected by various climate related challenges. And this effect has been overall to the all population, regardless of their caste, creed, religion, ethnicity, class, age, and gender. So this is an enormous effect in the region. The climate challenges have also affected the economy of the region, particularly if we look at the South Asia lost almost 26%, and South Asian region, Southeast Asian region, 37% of its GDP, which has affected overall the world with 18% of GDP loss due to the economic and due to these climate related challenges. On the contrary, when we see that what are the investment needs of South Asian and Southeast Asian countries, this table shares with you the details that requires the South Asian countries requires almost 775 US billion dollars until 2030, whereas the Southeast Asian countries require around 566 billion US dollars until 2050. But when we see that all the IFIs and the multilateral development banks, including Asia Development Bank, Asia Infrastructure Improvement Bank, IMF, New Development Bank, World Bank, all together, what they are contributing to these countries is like a very, very small amount as compared to the requirement. When we look at these 8 South Asian countries, they roughly need 200 billion US dollars per annum until 2030 to deal with the challenges. Whereas if we see that how much has been given until this date, like US dollar 1.2 billion per year on average, starting 2002 and until 2021. So it means that there's a huge gap, and there are lots of disparities among the countries. Like 75% of the this support is going to India, and 12% is going to Bangladesh, whereas the Pakistan's requirement as one of the most climate hit country are more than them. So the regional disparity is also reflected in our study. Countries like Bangladesh, Pakistan, and Thailand, which are low emitters of greenhouse gases, receive financial support for reduction of greenhouse gases and not for adaptation and mitigation measures, as they face extreme climate risks and challenges such as floods, cyclones, heat waves, and food insecurity. So this is a kind of misalignment that reflects the prioritization of financial interests by the powerful stakeholders over the immediate needs of vulnerable nations and their communities, that actually undermines efforts to protect lives and livelihoods in the region most affected by the climate change. Like we have many other examples, including Mekong River Delta region in Southeast Asia. If we see the utilization of fund in climate related funds in the health and well-being of vulnerable communities, there are several projects that has helped actually to reduce mortality from extreme weather events, particularly the funds helped in creating early warning systems, cyclone alerts in Bangladesh that has actually supported many people in 2020 Then there were like programs to mitigate climate-sensitive diseases that was funded to facilitate water management systems in Jakarta that has helped to reduce outbreaks of waterborne illnesses in flood-prone areas of Indonesia. There are certain other programs to improve food security and nutrition in India that actually helped uh, drought-resistant crop initiatives stabilize the food supplies to the um, marginalized communities. That has helped for lower rates of child nutrition and stunting linked to crop failures. There were some programs to facilitate access to clean water and sanitation, particularly in Vietnam, in the Mekong Delta river region. These programs helped salt water intrusion to address the salt water intrusion and also help to reduce diarrheal diseases from the contaminated water. There were some programs related to the air quality improvement in Cambodia. The investments were on renewable energy programs. Then there were certain programs for mental health and livelihood stability that has helped the marginalized communities and the community at large in Philippines from post trauma and psychological disorder and anxiety after climate shocks. Uh, there were certain programs to strengthen healthcare infrastructures that was as a good investment in Nepal on health clinics that sustained access to maternal care and emergency services during disasters. So these were some of the examples that actually gives an idea that how PDBs, MDBs, as well as the international financial institutions are investing on health and well-being of marginalized communities in South and Southeast Asian countries. But there are certain systemic challenges for the allocation and accessibility of climate funds. Um, and these challenges are quite prevalent in the region. One of the challenge is bureaucratic processes, quite complex green climate fund accreditation requirements usually delay projects. One example is Nepal, where local NGOs lack financial systems to meet fiduciary standards. So there is a dire need of building the capacity of the local civil society organizations so as they are able to actually deal with the fiduciary standards of the PDBs and IFIs. Only 12% of Bangladesh health-focused climate proposals were approved in 2023 due to the documentation gaps. So this is somehow identify the capacity of the government and the related departments who wanted to invest in the public health sector through the PDB fundings. Data and evidence gaps were also identified in India, as unmentioned in her presentation. The data gaps, the street vendors in India during the heat stroke, there were a lot of mortalities, but those were not actually counted. So therefore, there were lots of challenges in dealing with the challenge. So 60% of the Southeast Asian climate adaptation proposals fail cost-benefit analysis due to inadequate localized health impact projections. So this requires, the critical understanding about the cost-benefit analysis by the government who actually want to want to reach out to these funds. Misaligned donor priorities. This is interesting gap that we have identified. ADB's 2022-2024 climate portfolio allocated less than 10% to health care systems in Southeast Asia, favoring energy transition over zoonotic disease preventions. So generally what happens is that PDBs, MDBs, IFIs, they like to invest on large scale infrastructure and energy programs instead of investing on health and well-being of the marginalized communities. Mental health support receives only 2% of the post-disaster climate funds in Philippines, despite post-trauma and psychological disorder rates exceeding 30% of the Typhoon Haiyan. Marginalized groups are often excluded. We have seen that Indonesia climate resilient housing programs require land titles, excluding 70% of the Jakarta flood affected informal settlers. Women in rural areas of Odisha, India, face barriers accessing climate insurance due to patriarchal norms around financial decision making. So there are certain other challenges like short-term funding cycles, debt burden concerns, corruption and leakages. These are quite obvious in various programs that are being funded through the PDBs and IFIs. And for example, some of the countries are now trying to handle these challenges. For example, Philippines now uses blockchain for the Green Climate Fund tracking, reducing leakages from 22% to the 9% in 2023. Capacity limitations, I have already shared this. With that, PDBs are also investing on the technical assistance programs. Particularly, they have earmarked 50 million US dollars for Thai and Vietnamese officials on climate health proposals drafting. There are challenges on intersectional risks. They are often being overlooked. Bangladesh cyclones disproportionately affect pregnant women, 20% higher mortality risks, yet less than 5% of the climate health funds target maternal care. So this is again a challenge. Climate funded social protections in India often exclude Dalit communities facing caste-based barriers to disaster relief. There are certain legal and regulatory barriers, and Nepal insurance laws block climate risk coverage for informal workers. 65% of the workforce leaving them unprotected during floods. So some of the local and national laws and regulatory frameworks are also creating hindrances in reaching out to the marginalized communities in the region. There are certain recommendations that we.
Alicia, can you wrap up in about 1 minute?
Yeah, just
Thank you.
concluding, there are certain recommendations. The IFIs and the other stakeholders should increase transparency and prioritize local needs in their interventions. IFIs and MDBs should support bottom-up approaches and promote gender equality through their interventions. They should also ensure climate resilient public-private partnerships to leverage private sector investments. There is a dire need for greater support for climate resilient ecosystem based approaches and addressing debt sustainability issues. There is also a dire need to improve IFI led initiatives to address loss and damage caused by climate change, particularly in South and Southeast Asian region through increased funding, enhanced collaborations, capacity building, and community based approaches. In a nutshell, a comprehensive strategy is required while addressing governance, financing, and capacity building alongside promoting knowledge sharing and learning among countries and communities.
think we lost Zia for now.
Yeah, I think so. And I think he's frozen on my screen as well. But I think he was at the end. So I think we can
it's the
move.
last slide.
Yeah, I think so.
So maybe when he comes back, he can share further thought at the end, and to ensure the the agenda to go smoothly. Should we let's move to the next presentation. And so next in our agenda is presentation by Dr. Patch Pillai Latanan. Patch is a full-time lecturer of Human Geography at Department of Geography at Chulalongkorn University. She graduated with a doctoral degree in geography from University College London. Her research focuses mainly on urban development, smart city, resilient city, community resilience, and middle class in Southeast Asia, particularly in Thailand. Over to you, Patch.
Thank you very much. Hello, everyone. And actually, my office is under renovation. I hope the noise will not disturb us too much. Anyway, so I'm working in a research group, and I'm a representative of our research group, which is working on climate change perception and realities in Eastern Thailand, learning from community responses on flooding, factories, and land conversion. This research project is funded by British Council, Catalyst Grant, Thai-UK World-Class University Consortium. Participating institutions are Chulalongkorn Universities from Thailand, University of Sussex, Bristol University, and the London School of Economics and Political Science from the UK. Contributing author of this research is Arirat Patnukra, Phet Pillai Latanan, Puttaporn Ari Prashakul, Panni Shiwin Siriwat, John Barlow, Hun Bangshin, and Jonathan Rick. So actually, what we are working now is the second project. We already study about the casualty to blame in Rayong, about exploring flooding, factories, and land conversion in Eastern Thailand. And from our previous research, we found that the local did not blame government or private sectors for floods, but they blame themselves and they accept the consequences. Moreover, the local, rarely talk about climate change. But climate change and natural disaster have become fundamental issue for many nations, leading the proliferation of mitigation and adaptation plans. However, it is quite difficult to differentiate the impact of climate change from the ordinary disaster that the local community face. And there are literature talking about climate change awareness, which is depend on level of education, income of the residents. Moreover, the centralization of policy formulation and implementation remains a major problem, constraining the effectiveness of multi-level governance in implementing climate change-related policies on ground. Therefore, it is interesting for us to explore climate change perception and related policies at multiple levels. So we aim to advance our insights into community resilience amidst climate change in Rayong province. And we aim to study the perception of government officials, policymakers, and other professionals involved in formulating, implementing climate change mitigation and adaptation policies at multiple levels, from central government, local government, and the local themselves. Specifically, we want to understand their views on the link between climate change and flood event in Rayong province. This brings about the three research questions of us. First, how is climate change perceived by government authorities? local government authorities, and local populations. Secondly, how are climate change, flood, and drought linked? And last, how do mitigation and adaptation policies for flood, droughts, and climate change play a role at national, provincial, and local level? So this slide shows the location of our site or study area. We choose 2 villages from Rayong province. The first village is in figure A, which is Nong Lalok village. Nong Lalok village located in Rayong province in eastern region of Thailand. It's หมู่ 3 บ้านหนองละลอก sub-district, Ban Khai district. And the second village in Rayong as well, in the picture B, หมู่ 4 บ้านทับมา sub-district, เมือง Rayong district. So in short, Thap Ma village. Since we have the 2 sides of our study, so we choose in-depth interview and focus group discussion methods to collect our data. The research participants that we selected to include in our study, we use purposive sampling and snowball sampling to collect them. And for the research participants, we divided them into 2 main groups. The first group is the key informats. In the key informats group, we subdivide them into 2 levels as a central government and the local government. For central government, we interview National Hydro-Informatics Data Center officer, Department of Public Works and Town and County Planning, Geoinformatics and Space Technology Development Agency, and Department of Climate Change. For the local government authorities, we choose Rayong Provincial Office of Disaster Prevention and Mitigation, Rayong Royal Irrigation Department, Mayor of Thap Ma, Head of Thap Ma Village, and Head of Nong Lalok Village, which is the village that we choose to study. For the second group, the local residents, definitely they are from the 2 villages of our case study area, Thap Ma and Nong Lalok villages. So the total participants are 20 persons. The data was collected from June to December 2024. We transcribe our data and use thematic analysis to analyze our data. And then this is what we got from our field work. To answer the first question, how is climate change perceived by central government authorities, local government authorities, and local population? For the central government, definitely themselves has a very clear perception about climate change. But they see the local residents do not understand the climate change. Why is that? They claim that the local only concern about issues that affect their lives, such as drought and flooding. For the local government authority, they seem to occupy the same idea that the local residents do not understand climate change. Acting head of the Rayong Provincial Office of Disaster Prevention and Mitigation said that the locals do not understand climate change situation because climate change seems to be distant from their lives. They may not think climate change is related to them. But in reality, that we found on ground, that we actually talked to the villagers, I pick up 3 quotations from 3 members of the 2 villages. The first one talk about climate change. They say that climate change causes drought. It had become more severe lately. Second one, irrigation systems are not enough to save water for dry season. So the communities has to buy fresh water. And last one, in the past, we can drink rainwater. Now rainwater is undrinkable. This is due to factories, dust, or maybe climate change. So it cannot deny that local people often do not understand the science of climate change, but it doesn't mean that they do not aware of the changes. They are conscious of changes in weather pattern, and they refer to this as a climate change. So local people understand climate change in different way from the authorities. And the impact of weather pattern that they see actually affect their health and well-being. Since they talk about water, like lack of water, undrinkable water. And when we look into the cause, the perception about cause of climate change, all three, the local government, central government, and the local, they mention about land conversion and human action. But for the government, both local and central, they see human action and land conversion as one factor, because human is the one who make the land use change. But for the local population, they see it differently. They divided factors into two, land conversion and human action. For land conversion, they see land conversion as something that related to change of earth surface, such as filling in swamp, or a change from agricultural land to industrial estates, residential land use to industrial estate. And for human action is something that humans directly do it, like deforestation, burning rice field. So that's the perception that differences among the three groups. To answer the second question, how are climate change, floods, and drought linked? There's a division between government agencies. Since the central government said that climate change is one of floods and drought causes, there are others factors that cause climate change. But for local communities and local authorities, they are divided. Some of them agree with the central government, but some of them say that climate change, yes, it causes drought, while flooding causes land conversion. So there are the differences in the idea of people from different sectors. And to answer the last question we have, how do mitigation and adaptation policies for flood, droughts, and climate change play a role at national, provincial, and local level? The local, unfortunately, they're unaware of policies of central government. One of them say that the government hasn't helped us at all. So it means that they don't see any policies that help them with floods, drought, or any other disaster or the climate change impact that they are facing. And for the local authorities, they say that they have no direct policies related to climate change, but they have policies and action plan to mitigate and adapt, an adaptation plan for flood and droughts. Basically, the disaster that suddenly happened or often happened in their location and their responsibility. But at national level, they have plenty of projects, policies, and action plan to establish mitigation and adaptation of climate change. And if we look closely in their plan, we will see that one of the issues that the government trying to insert is creating resilience community, which is directly related to health and well-being of the community, such as water management and waste management. So from what we collected, the data, we come to the conclusion that both central and local government underestimate the local relate climate change knowledge and understanding. But how the effect of climate change are understood and experienced between government agencies and the locals, or even the local authorities, are not the same. So with these experience, that differences, they may see things differently. And we found that there is a disconnection between policies related to climate change from central agencies to local agencies who actually apply it, and the local residents who actually related to these policies because they are the one who received the impact, direct impact from climate change and disaster. But the disconnection has already emerged. And finally, climate change is related to health and well-being of the local, which we can see from what they talk about: lack of fresh water, not enough fresh water, and the water is undrinkable, air pollution. Nevertheless, there are very few policies that directly deal with health and well-being of the local in the Rayong province and probably other places that directly answer to what they actually want. But this is what we found at the moment, that the government may need to find the connection between themselves and the local authority and the local people. And here is the faces of our team member. Some of them might be familiar to you. And if you have any questions, you can put it in the Q&A box or save it for later Q&A session. Otherwise, you can email me to the email given in this slide, pechpilai.l@juฬac.th. Thank you very much for your participation.
Thank you so much, Patch, for staying so much on us so on time. Thank you for such a fascinating presentation. I learned a lot from the talk. And now we are moving to the last presentation by Dr. Lộc, Nguyễn Đức Lộc, Võ Thúy An, and Nguyễn Khánh Lê. And Lộc is the director or president of the SocialLife Research Institute, and Thúy An and Khánh Lê are the researchers of SocialLife. And over to you, Lộc, An, and Lê.
Hello, everyone. Our presentation, that's the part of the project, the health impact, the outdoor worker in the urban Vietnam. So today we will to present about the result of the qualitative analysis, and Miss Anne and Lê will to present the presentation, and I will to come back the discussion part. Now I would like to invite Anne to.
Yeah, thank you, Dr. Locke. So now my colleague Lê and I will present our team led by Dr. Nguyễn Đức Lộc research to share with you our qualitative findings of the study on Vietnamese urban precarious outdoor workers adaptation strategies to climate change in terms of health and well-being. And this report is the result after 1 year approaching the community of elder workers in Vietnam's big cities, including the official in-depth interviews conducted from May to December 2024. It reviews the harsh realities that precarious workers in Vietnam face under the intersecting impacts of climate change and livelihood insecurity. And our presentation will go through 6 sections, from research questions to key takeaways, as you can see on the slides. And our research questions including 3 following ones. The first one is about the underlying reasons behind workers' decisions to participate in the precarious outdoor labor market. And the second is where health concerns related to climate change stand among the priorities of elder workers. And the third one is their coping mechanisms for climate change. And to answer the research questions, we choose to analyze the findings through the lens of James Cole's moral economy theory, specifically the safety first principle, stating that the subsistence of farmers prioritize economic security over profit, and they will eschew any opportunities that even slightly increase the chance of falling below the subsistence line. We used the theory since, like Scott peasants, Vietnamese urban precarious elder workers have very low income, often lack formal protection, and depend on informal networks and social norms to survive. And viewing the choices through the lens of moral economies helps explain how they navigate health risks and economic pressures, and help design better social policy for them. And to collect the data for the findings, we use the qualitative methods with fieldwork, in-depth interviews, and focus group discussion with 40 precarious elder workers who had joined our quantitative survey before in 4 cities: Ho Chi Minh cities, Hanoi, Da Nang, and Cần Thơ in Vietnam, and in 4 sectors: street vending, ride-hailing services, construction, and porting. And now I will let Le to share our key findings.
Thank you, Anne, for such a comprehensive introduction. Hello, everyone. I'm Le. I would like to share our research findings. We have identified 3 key points in here. Firstly, the reason why elder workers choose independent work. Secondly, we explored the complex trade-off between livelihood and safety in their work. And thirdly, I will talk about the way that elder workers should deal with their health issues and indicate a phenomenon where health risks are often downplayed, and leading workers to develop creative adaptive strategies. So I will start with our first finding about pathways to informal work through the concept of freedom. Our research showed that freedom is crucial for elder workers choosing informal work, and it has multiple dimensions. As you can see on the screen, it's freedom shaped by different demographics, freedom capital as an asset, and freedom as a strategic decision. So let's move on to freedom from male perspective. Our interviews with male elder workers so that they bring rural habits to the city. They are familiar with self-employment in agriculture and working for themselves, making it difficult for them to adapt to strict workplace rules. And they strongly prefer autonomy and flexibility over rigid schedules. For women, independent work isn't simply tied to work autonomy at this moment, but rather relates to their ability to balance income and family care responsibilities. Our interviews show that they prioritize work that offers temporal and spatial flexibility, led them to fulfill their childcare roles in the family. So they can be served as a compelling evidence of the double burden that Vietnamese women face in Vietnam society. And for elderly, they want to maintain their independence to preserve their dignity, and they often feel uncomfortable relying on their children for financial support. So this illustrates how many Vietnamese people view financial independence as crucial to maintaining their status and dignity within the family, especially as they get older. And secondly, moving on to this concept of freedom capital as an asset. So workers value the ability to diversity income from multiple sources as a form of like valuable capital. So they also appreciate the ability to fulfill social cultural obligations, which formal job with fixed schedule might restrict. So in Vietnam, as an elderly member of family and community, they're absent from important occasions like death anniversary or the weddings, so on, would be unacceptable. And third, we discovered that freedom in informal work presented a like strategic decision for this worker. What we found is that workers' occupational choice and random but reflect a like complex interaction between labor market demands and their available personal resources. So these workers are making strategic decisions within their limitations. So they recognize the barriers they face in the formal sector, such as lack of qualifications, education, or specific skill, and choose informal work as a practical strategy that gives them a measure of autonomy within these constraints. So it's not simply that they can't accept formal work, rather, they actively weighing up their option and making strategic decisions based on their specific circumstance. So next slide. Freedom and safety are often viewed as opposing value in workers' livelihood strategy. So while safety ensures stability and predictability for the future, freedom opens up space for flexibility, but comes up like higher risk. For urban precarious outdoor workers, this trade-off becomes even more intricate as they prioritize livelihood security over health security. So now we come to the next point, which is health safety second, when workers prioritize livelihood over health concern. So our research has led us to rethink the traditional safety first principle when it comes to the precarious outdoor workers. So we observed at a significant shift from like workplace safety to livelihood security. They willingly accept working under harsh conditions like enduring intense sun, rain, pollution, and various other health risks in exchange for the autonomy they gain in earning their livelihood. So this reveals something like profound about their priority. For this worker, freedom of choice become a more vital form of livelihood insurance than safe working condition, and they are essential trading physically safety for economic security. So this finding has important implication for how we approach occupational health and safety policy for informal workers. Traditional approach that just simply focus on improving physical working condition might miss the mark if they don't account for this fundamental priority of autonomy and livelihood security. And despite the health risks associated with poor working conditions, many other workers prioritize their income over health concerns. So this normalization of health risks were clearly evidenced in our focus group discussion. One construction worker said that working outdoor means you must endure the sun, rain, and dust, right? There's no problem. If one saw any problem, they couldn't have chosen the job. So for workers who are the breadwinner in their family, healthcare often takes a backseat to livelihoods as they continue working and they believe that they still healthy enough. This attitude may reflect a concerning reality about precarious workers' access to healthcare services. Financial barriers are the primary factor preventing them from engaging in healthcare services. Even its most basic level, as you can see in the screen, the cost of general health checkup remains a significant burden for those with precarious incomes. So from second finding, you can see that outdoor workers typically minimize health concerns. So they help police lead to various protective practice in their outdoor work environment. So I would like to move to the third finding, creativity in scarcity, coping mechanism for climate change. So one fascinating aspect we observe is how outdoor workers are utilizing unverified information sources to deal with their challenges. Without access to formal healthcare system or official guidance, these workers would like to access health information from freely available sources. This include like word of mouth for knowledge and increasingly the social media platform like YouTube, Facebook, or TikTok. Despite limited resources and formal support, they actively seek out knowledge and create informal network of information sharing. A significant challenge that we observe is that numerous informal workers either cannot afford voluntary health insurance or do not consider it a priority to access hospital health screening. They end up looking for a cheaper option instead. So our research revealed a strong preference for traditional remedies among informal workers. These remedies are regarded as safe and effective, but not on scientific validation, but on workers' like personal experience and community wisdom passed down through generation. So there are various practices being employed across the communities, like the use of corn roping as demonstrated by 7 years old vendor worker in Hanoi, as you can see in the screen, or applying medicinal wine to aging body parts and various massage techniques. So they have diverse adapted equipment and practice to cope with climate change, like they wearing hat, glove, or some protective clothing. They drinking more water or reading more regularly. So I would like to show you some picture from our field work that you can see outdoor worker taking a rest and hiding under the bridge or by the shade of the tree taking a rest. So this is our finding. I would like to leave the floor to Anne to further discussion.
Yeah, thank you, Lei. So from the findings, we have some viewpoints to discuss through the lens of moral economy theory, and then provide some policy implications. So first of all, according to Scott's concept of the subsistence ethic, subsistence isn't just about the material needs, but it's also a moral standard valued by the community. So like Scott's peasants, our outdoor workers also struggle every day for their livelihood. Therefore, policies for this group should respect subsistence ethics and avoid conditions that undermine their basic needs. And in addition, we must also pay attention to their deeply human needs, which can be seen as a new form of their safety. These include self-determination, dignity protection, and responsibility to family and community, as they presented in the key finding section. In doing so, we should avoid victimizing them as miserable individuals, but see them as individuals with their own aspirations and the right to make decisions about their lives. So in general, these are some key takeaways to conclude our presentation. As you can see on the slide, because the limit of time, I will not elaborate it one more time, but I just want to emphasize that taking outdoor workers' subsistence into account, including understanding their basic needs and also moral values, can help decide better health climate policy for them. And it's also crucial to expand moral standards in policy making by considering other human needs of outdoor workers, like self-determination, dignity, and family and community responsibilities. And last but not least, we shouldn't enforce any rules or conditions that violate their fundamental needs, as well as seeing them as helpless individuals, because they also have other humanistic demands and when they choose outdoor jobs. So with well implement these ideas, it can increase the possibility that workers can benefit from the welfare policy suiting their needs and context. And this also the last part of our presentation. And thank you so much for listening.
Thank you, Lộc, Lê, and Anne. It is really fascinating presentation, and it is really eye-opening information and knowledge about the outdoor workers in urban Vietnam. Now we open the floor for the questions, and let me see if we have any questions in the Q&A. So there's one question that whether the slides will be shared with the participants later. And yeah, anyone who, any presentation which we have consent for sharing, will be shared and circulated to the participants. And any there's no other question. Please, if you have any question, please put in the Q&A, and we are very happy to answer.
I wonder, Anne, as we got a gap, can I ask Zia a question?
Yeah. Yes, please.
Yeah, Zia, I was wondering, you showed some really interesting slides about the differences across South and Southeast Asia in terms of levels of need, the kind of support that's being provided. And I was wondering how you explain those differences. I mean, I think there were some countries like Myanmar where we have no data. There are other countries which, seem to be doing relatively well compared with others. So is that, how do you interpret those differences?
If I would actually refer back to my last slides where I was actually sharing with you all that this is a challenge at the end of the capacity at the end of the government, as well as the capacity at the end of the civil society to reach out to the climate finances. Say, for example, in one of my slides, I mentioned that 75% of the allocated resources are being tapped by the India because the government has this capacity to reach out to those funds available. And on the other hand, in Pakistan, where the needs are too many, the government has no capacity to reach out to those funds available. So this is one. The second, I think there are certain other structural challenges that are hindering actually some of the countries, particularly you mentioned Myanmar and some others, which are not getting access to these financial support.
Thank you, Zia. Patch, I really enjoyed your presentation, and if I may, I would like to have a question to Patch. So from my understanding that there's a misalignment between the perceptions by the central government and by the governments themselves and the local people about the climate change. So could you help us understand a little better why the government perception about why the governments tend to downplay or disregard the knowledge and awareness of the local people about the climate change?
Okay, so from what we talked to them and interviewed them, I think they underestimate them because it's related to the literature that's saying that people with lower education, lower income are not actually, it's affect their perception towards climate change, that one thing. And the other thing is that the government emphasized that the local people only pay attention to the things that actually directly affect them. Not that, because the climate change is a big issue that has a impact on drought, hot weather, flooding, but it's too big for the local. But the local, they're concerned about something smaller that actually affect their lives, their agriculture, their work, like they're working on agriculture. So water is very important to them. Flooding cause massive problem to them with the crop and stuff. So I think that's why the government underestimate the understanding of the local people and putting them like, okay, you are only concerned about yourselves or something that related directly to you.
Thank you for that, Patch. Zia, I saw you raise hand.
Yeah, just wanted to ask a question because most of you are the academics. So, what is happening nowadays is that overall funding and the aid is being cut. Just last evening, Stammer also announced that he will cut the aid and invest on the uh, defense, So how you people have been thinking on, because it would further affect the climate financing ability to and raise the challenges for the vulnerable communities, particularly in our region. Maybe John can talk on this, or Anne, you want to respond?
Yeah.
Go first maybe, and then I can chip in after that.
Yeah, I mean, I know, Zia, it was only yesterday that Starmer announced his reduction. I mean, the UK aid budget's gone from 0.7% of GDP to 0.5% under Johnson, and now from 0.5 to 0.3. And of that 0.3, an awful lot of it is already allocated to grants to multilateral organizations. So the amount that's available for funding organizations outside the multilateral is tiny. So, I mean, it's being really squeezed. And I mean, domestically, kind of politically, it's easier to cut the aid budget and to cut the health budget, which for someone like me, of course, is kind of tragic. But it's the politics of it, and of course, what is happening with Ukraine, Europe, President Trump, and so on is driving it. But it's happening day to day. So we're still trying to kind of come to, get to grips with what on earth's going on from one 24 hours to the next. There's no sense of carefully thought through strategy here. It's, Starmer responding to something which only emerged, days ago. And it's the easy kind of option at the moment. But of course, considering what we're talking about here today, I mean, it's sort of tragic because it's squeezing the funds available for the sort of work that you're doing, Zia.
Yeah. Zia, thank you for asking this question. I think following up with Jonathan about the cut of the development aid, in terms of funding shortage for a grant, lack of the grant for the research, obviously in academic research will be heavily affected as well. But I mean, I try to be positive as much as I can. But looking on the bright side, when we have to face heavy shortage of grant or funding for research, the government, the UK government, will place higher attention, or will really focus on the impact of what they fund. So it means that academics need to be well prepared, needs to be more ready to produce high impact research. The question around the impact of the research will be put more to the fore. So I think now I'm not sure if Jonathan is agree with me, but I think now we keep thinking very hard and critically about how we can make research translate into the policy outcomes. So that question is more critical than ever. Let me see. Is any other questions from the audience or from the panelists from Lok, Anne and Lei, or Patch? I think it seems there's no further questions. Jonathan, would you like to do some reflection on to share some thought to reflect on the event or on the presentations that we have today?
Sure, Anne. Yeah, I mean, it's been a sort of fascinating insight into the different work that we're doing across the region. And I mean, of course, I can't do justice to what's been presented over the last hour or so, but I mean, I thought Zia's presentation was interesting because he was highlighting a kind of real gap between sort of what is needed and what is delivered and how we understand that gap. I thought Ajahn Pet, I mean, her presentation was identifying a different sort of gap, which was a gap between the experiences of climate change at local levels and the framing of climate change by government departments. And, you know, we're almost there sort of approaching things in different ways. And then the presentation from Lok, Anne and Lei, I think a gap between kind of what we know about climate change and what we know about those who are exposed to climate change. And I thought there was a different sort of gap was being highlighted. So although all of the presentations were dealing with different sets of issues, and I suppose in terms of our presentation, it was a gap between, you know, the literature in English and the literature in Vietnamese. I mean, all of them are identifying a sort of knowledge gaps that we need to think hard about. But I suppose the last thing to say, and this came through in Lok, Anne and Lei's presentation, is that we really do need to avoid this tendency to paint the individuals and the households, the societies we're interested in understanding as kind of how victims, that this is stuff that's happening to them, they have no control over. And what comes through is actually people are, you know, they are doing some really interesting things to address the challenges, and giving them that sort of agency to address the challenges and give them that level of respect is also really important. So I've enjoyed this morning. It was worth us in the UK getting up at 4 o'clock in the morning in order to listen to some really fascinating presentations. So thank you, everyone.
Thank you, Jonathan. It's really, really great reflection. Yes, I agree that we should avoid, and I think not only academics, researchers, but also practitioners and development sector, we need to avoid victimizing vulnerable, marginalized populations, you know, to contribute to leaving no one behind. It does not mean that we have to make them look like victims of what we do or what we do not do. So just try to acknowledge them with the full agent as people with agency and with the capacity to make decisions about their own lives. I think that is something that this forum, Asia Pacific Forum on Sustainable Development, and also our side event wants to create this takeaway message. So this. And thank you so much, everyone, for spending time and giving fascinating presentation in this event. So we are now, closed. We bring the event to a close, and I want to sincerely thank each of you for your time, for engagement, and for invaluable contributions. And our participation today has reaffirmed the critical importance of advancing science-based, inclusive, and equitable solutions to address the health and well-being impacts of climate change in urbanizing Southeast Asia. And a special thanks to our esteemed speakers, Jonathan, Patch, Zia, Lok, Lei, and Anne for their insightful presentations and reflections. And their expertise has helped us deepen our understanding of the intersections between climate change, health and labor, and structural inequalities in the region. And I would also like to extend my appreciation to my colleagues at NatCen, Irina and Driver, and Katie Krupp for their dedication behind the scenes in ensuring the success of this event. I think the last one I want to highlight again that this discussion strongly aligns with the objective of the Asia Pacific Forum on Sustainable Development 2025, which is focused on advancing sustainable science and evidence-based solutions for the 2030 agenda. And now we are now 2025. We have only 5 years to go to reach the end of the 2030 agenda. So after this agenda, what next? We will wait and see, after 17 Sustainable Development Goals, what will be put in place. So our discussion today contribute directly to the global dialogue, which lead to the high-level political forum in New York in July 2025 this year. And this discussion, our discussion today continue to reinforce the need for the climate and health and well-being policies that truly leave no one behind. And so before we conclude, I encourage you to explore the research reports that my colleague has put in the chart. And we already share in the chart. And these reports about the impacts of the climate change on the health and outdoor workers, and also the report from Asia Development Alliance on climate finance, on the effects of the climate finance. So thank you once again for being here today. And I look forward to seeing many of you again in our future events. Thank you very much.
Thank you.
Thanks, Anne. Excellent.
And thanks